Welcome everyone to another session of CoderWeb training. In this session, we will focus on understanding the medical certificate of cause of death, often referred to as the death certificate, and why it is so important for accurate mortality data. The medical certificate of cause of death is the key source document used to record causes of death, and it forms the foundation for how cause of death data are coded, are compiled, and interpreted. We will also cover the definition and purpose of cause of death and the underlying cause of death, which is the cause that initiates the events leading directly to death. By the end of this session, you should be able to confidently explain what the certificate records, understand the purpose behind cause of death reporting, and recognize how the underlying cause of death is determined for proper coding and reporting. A quick reminder, CoderWeb training is designed as an introductory gateway to ICD concepts and terminology. It is not a substitute for a formal, comprehensive ICD training program. For full proficiency and certification, please pursue an in-depth instructor-led course delivered by recognized ICD training providers. While ICD-11 is taking shape, ICD-10 remains actively in use during the transition. To support you, this program will continue to address ICD-10 topics in upcoming sessions, ensuring you stay proficient across both coding systems. Thank you for joining this important journey. Together, we will leverage ICD to improve mortality reporting, enhance patient outcomes, and strengthen health data worldwide. Let's start with a high-level look at what's new, what remains familiar, and how the transition will influence your day-to-day coding practice. My name is Saman Gamage, and I am a medical doctor with a specialization in public health. I currently serve as a senior technical advisor on medical certification and ICD within the Bloomberg Data for Health initiative of the CDC Foundation, and I will be your guide through this presentation along with Patricia Wood and Yusuf Hamad. The content of my presentation was reviewed by the two coding experts, Patricia Wood and Yusuf Hamad. This is the expected outcome of this session. At the end of this session, the students will understand the international form of the medical certificate of cause of death. Here is my lesson plan for today. I will first explain cause of death, the definition and the purpose of underlying cause of death, medical certificate of cause of death recommended by WHO, reporting contributory causes and time intervals. We will discuss some case examples and general guidance for completing medical certificate of cause of death. This session is all about death and death certification and death certification formats. However, I would like to start talking about life. As doctors or other healthcare professionals, we play important roles in patients' lives, no matter their ages, cultural backgrounds, or medical needs. We ask people to do what is right for their health and the health of their loved ones. We help people when they are hurt or have fallen ill. We comfort people when they are scared and not at their best. In other words, we do the maximum possible justice to our patients because we have been trained to do so. With our treatment, most patients recover, but some may die. When our patient is dead, most of us think our duty to the patient is over, which is not correct. Even if our patient is dead, our duty to the patient is not over. Maybe our duties to the living patient is over. However, you are required to complete an accurate medical certificate of cause of death. In other words, you are required to record the causes leading to death in the specified format. So this is our duty to the patient or the duty to the deceased. Not only that, we have a duty to the family members of the deceased because family members would require the medical certificate of cause of death or the death certificate for legal and other purposes. And it is also a duty to the society because our society would like to know from what causes people die. As you know, death is inevitable. We shall all die in one day. However, it is important to know why and from what causes people die. Let's start our discussion talking about cause of death. What do you mean by cause of death? Is there a definition? As it has been defined by the World Health Organization, the cause of death means all those diseases, morbid conditions, or injuries which either resulted in or contributed to death, and the circumstances of the accident or violence which produced any such injuries. In this definition, I have highlighted all those. This means all the diseases, all morbid conditions, all injuries resulting in or contributing to death. This means there are two types of causes of death. There are some causes resulting in death, and there may be other causes contributing to death. Both types of causes we have to record in the medical certificate of cause of death. And the circumstances of the accident or violence. This means the death is caused by an accident or violence. The certifier should record the circumstances of the accident or violence. Therefore, the cause of death means all those diseases, morbid conditions, or injuries which either resulted in or contributed to death, and the circumstances of the accident or violence which produced any such injuries. So, what is the purpose of this definition? To ensure all the relevant information are recorded and to ensure certifier does not select some conditions for reporting and reject the others, he has to report them all. And most importantly, this definition does not include symptoms and modes of dying, such as heart failure and respiratory failure. Concept of underlying cause of death. Now we discussed about the cause of death, and then there is another concept, underlying cause of death. When only one cause is recorded, this cause is selected for tabulation. The reported single cause becomes the underlying cause of death. Single cause on the certificate, and this is also the underlying cause of death. When more than one cause is recorded, there is need to select a single cause for reporting. The selection is done by the coders, or precisely speaking, mortality coders using mortality coding rules. This single cause is usually given the special name underlying cause of death. When more than one cause is recorded, coders apply mortality rules, select a single cause, and it is given the special name underlying cause of death. Therefore, the underlying cause of death is the condition, event, or circumstances without which the patient would not have died. The underlying cause of death is defined by WHO as the disease or injury which initiated the train of morbid events leading directly to death. The disease or injury which initiated the train of morbid events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. The definition of underlying cause of death was adopted in 1946, and it was included in ICD 6, the sixth revision of ICD. The World Health Organization first defined the underlying cause of death in 1948. The definition was agreed upon during the sixth decennial International Revision Conference, and it has remained the disease or injury which initiated the train of morbid events leading directly to death, or the circumstances of the accident or violence which produced the fatal injury. The WHO adopted this definition to standardize global health statistics by designating a single cause for routine tabulation. Public health officials are able to accurately compare mortality rates and monitor disease trends across geographic regions and over time. Let's discuss an example. A cancer patient dies, and the immediate cause of death was congestive cardiac failure resulting from carcinomatosis. Carcinomatosis means widespread dissemination of carcinoma in the body. The original neoplasm site was colon. For the benefit of our listeners, coders, I will explain some of these medical terms. And we talked about colon. Colon is the large intestine. Colon has several parts: ascending colon, transverse colon, descending colon, and then sigmoid colon, opening into the rectum and anal canal. So here is a neoplasm originating in the colon. Here is another image or diagram of a tumor or neoplasm inside colon. Carcinomatosis is widespread dissemination of carcinoma within the body. So it can disseminate anywhere within the abdominal cavity or into the other organs. And here you can see a dissemination of a carcinoma in a female and also in a male. You can see the tumor and disseminated carcinoma deposits. And we talked about heart failure. What do you mean by heart failure? Heart failure means the heart muscle is too weak or stiff to pump blood effectively. It doesn't mean that the heart has stopped working, but rather that it cannot keep up with body's need for oxygen and nutrients, leading to fluid buildup in the lungs and body. It's something similar to hose pulling a carriage. So we can use the hose pulling a carriage analogy to explain the heart failure as a pump problem. When the hose can't generate enough effective work, the carriage, the body doesn't get the blood flow it needs. And if I explain heart failure technically, there are two terms we talk about: preload and afterload. Preload means volume of blood in ventricles at the end of diastole, in diastolic pressure, and preload is increased in fluid overload when there is increased venous return or when there is valvular regurgitation. And afterload is resistance the left ventricle must overcome to eject blood into circulation. And afterload is increased in hypertension, aortic stenosis, and also in increased vascular resistance. The fail in heart struggles when preload or afterload are too high, leading to reduced cardiac output and symptoms of heart failure. So let's combine all these together. So we heard this patient died of congestive cardiac failure, and congestive cardiac failure was caused by carcinomatosis, and carcinomatosis is the result of malignant neoplasm of the colon. Therefore, the underlying cause of death is the malignant neoplasm of the colon, and the direct cause of death or the immediate cause of death is congestive cardiac failure. So, underlying cause of death is the initial cause in the sequence directly leading to death, and the direct cause of death or the immediate cause of death is congestive cardiac failure. So, this is a causal sequence, correctly reported causal sequence. The international form of medical certificate of cause of death facilitates reporting the chain of events leading to death in a sequence. The international form of medical certificate of cause of death is recommended by World Health Organization for certification of death in all countries. Here is an image of the 2016 version of International Form of Medical Certificate of Cause of Death. This is actually the frame A of Medical Certificate of Cause of Death. There's another frame B, which we will not discuss during this presentation. As you all can see here, there are three main sections. In the medical data section, there is part 1 and part 2, and then there is another column to report time intervals. Part 1 has 4 lines, namely 1A, 1B, 1C, and 1D. The form is self-explanatory. You can see the arrows from D to C, C to B, and B to A. And then on the lines B, C, and D, you can see DO2 is printed. Line 1A, report disease or condition directly leading to death on line 1A for line A. Then report chain of events in due to order, if applicable, in the succeeding lines. State the underlying cause on the lowest used line. It shouldn't be the lowest line, it is the lowest used line. That depends on the number of courses in the sequence. Then we have part 2 for the reporting of other significant conditions contributing to death. Any other significant conditions that may have contributed to death are reported in part 2. Then you have a column to the right to enter the approximate time interval between each of these conditions and death. Therefore, the main sections of the death certificate are part 1 for the reporting of diseases or conditions directly leading to death, part 2 for the reporting of other significant conditions contributing to death, and then a column to record the approximate time interval between onset of each of the conditions reported on the certificate and death. So here is the part 1 to report the sequence of events leading to death. And this is part 2 for the reporting of other significant conditions contributing to death. And here is the column to record time intervals. Let's learn how we report these conditions in part 1. We have line 1A to report the direct or the immediate cause of death. If the condition reported on line 1A is caused by another condition, the cause of the condition in line 1A is reported in line 1B. If the condition on line 1B is caused by another condition, and this condition should be reported in line 1C. In other words, the condition in line 1C is causing or leading to the condition in line 1B. If the condition reported in line 1C is caused by another condition, the cause of the condition in line 1C is reported in line 1D. So when you reach this level, this condition or the condition reported on the lowest used line is the originating cause of the sequence. Originating cause of the sequence. So this is where the sequence starts. And when you reach that level, or when you reach the originating cause of the sequence, you are closer to the time when the patient was healthy. Because before the onset of this condition leading to death, the patient was healthy. So you go back in the history from the most recent condition to the most remote condition to report the conditions or diseases or morbid conditions in part 1 of the death certificates in a logical sequence. Part 1 of the death certificate has 4 lines for reporting the sequence of events leading to death, and these are labeled as 1A, 1B, 1C, and 1D. And remember, this is a standard labeling system. The direct cause of death is entered at part 1A. If the death was a consequence of another disease or condition, this cause should be entered at 1B. If there are more events leading to death, write these in order at 1C and 1D. Here are some important points. Always use consecutive lines starting at 1A. Never leave blank lines within the sequence of events. After 1A, use 1B. After 1B, use 1C. And after 1C, use 1D. If there is only one cause of death, it is entered at 1A. Each condition below 1A is a cause of the condition above it. That is, it is an antecedent cause or intervening cause. The initiating cause in the sequence is the underlying cause. The underlying cause of death is reported in the lowest fuse line. In the train of morbid events, it is the last wagon which is most important. As you all know, in a train, the most important compartment is the engine, without which the train would not move. However, in the train of morbid events, it is the last wagon which is most important, the condition reported on the lowest fuse line. Let's go through a case study. A 50-year-old woman was admitted to the hospital vomiting blood and was diagnosed as having bleeding esophageal varices. Investigations revealed cirrhosis and portal hypertension. The woman had a history of hepatitis B infection. 3 days later, she died. I will explain the medical terms included within this case study. Hematemesis is vomiting of fresh blood, and this could be due to some bleeding inside esophagus or the stomach. Can be caused by peptic ulcer disease, esophageal varices, and by other causes. Here you can see the venous engorgement inside the lower end of the esophagus. And here is another picture of esophageal varices and dilated veins in the lower esophagus is due to portal hypertension. That means the pressure generated within the liver circulation or portal circulation. And this patient is having portal hypertension due to cirrhosis. So you have esophageal varices, and we mentioned about ascites. So when there is cirrhosis, there can be ascites, accumulation of fluid in the peritoneal cavity, and that can be caused by cirrhosis and portal hypertension. The fluid accumulation within the peritoneal cavity can be caused by liver cirrhosis, heart failure, kidney disease. And we discussed about liver cirrhosis. So cirrhosis is late stage scarring of liver tissue. You can see two pictures, picture of a healthy liver and a cirrhotic liver. And there is when it is shrunken and it is nodular. There's no smooth surface in the cirrhosis liver or cirrhotic liver. So hepatitis B is known to cause liver cirrhosis. So there is a strong relationship between hepatitis B and cirrhosis. So now we have all the knowledge to construct the sequence of events leading to death for case study 1. Hepatitis B would have caused liver cirrhosis, and liver cirrhosis is the reason for portal hypertension, and portal hypertension has led to bleeding esophageal varices. So this is the sequence of events leading to death. Hepatitis B causing liver cirrhosis, and liver cirrhosis causing portal hypertension, and portal hypertension leading to bleeding esophageal varices. So bleeding esophageal varices will be reported in line 1A as the immediate cause of death. Portal hypertension is reported as an antecedent cause in line 1B, and we can also name this as an intervening cause. Liver cirrhosis is reported in line 1C as another antecedent cause, and the underlying cause of death is the hepatitis B, which is reported in line 1D. Here is the starting point, underlying cause of death, and this is the terminal event. Determining underlying cause of death is important. Bleeding esophageal varices was the direct or immediate cause of death. Hepatitis B was the underlying cause of death. Knowing this, the public health response is to implement immunization programs against hepatitis B virus to prevent such deaths in future. So why do we need to report the conditions in a proper sequence? If hepatitis B is the underlying cause of death, so why not just report hepatitis B on the certificate? So why do we have to report all of them? By reporting the causal sequence, we can identify the points for intervention. So we can prevent hepatitis B. So we know the prevention mechanisms for hepatitis B, vaccination, health education, and so many other measures. If there are any measures to prevent hepatitis B progressing into cirrhosis, and then management of cirrhosis in the hospitals, and then management of bleeding esophageal varices, blood transfusions, sclerotherapy, ligation of varices, stop or arrest to bleeding. So here are the points for intervention. So we know the causal sequence and all the causes are reported on the certificate, and then the points for intervention are obvious or clear. Part 2 of the death certificate, as you all know, which is colored in purple here, is to report other significant conditions contributing to death. Part 2 of the death certificate records all other significant or contributory diseases or conditions that were present at the time of death but did not directly lead to the underlying cause of death listed in Part 1. The condition should be present at the time of death if you want to report it in Part 2 as a contributory cause, and it does not directly lead to the underlying cause of death listed in Part 1. Then there is a column to report the time interval, the approximate interval between onset and death. The column on the right-hand side of Part 1 and Part 2 of the death certificate is for recording the approximate time interval between onset of the condition and the date of death. The time interval should be entered for all conditions reported on the certificate, especially for the conditions reported in Part 1. And these intervals are usually established by the doctor on the basis of available information. In some cases, the interval will have to be estimated. Time periods such as minutes, hours, days, weeks, months, or years can be used. Several minutes, few hours, few days, several weeks. These time periods and expressions can be used. If the time of onset is unknown or cannot be determined, write unknown. This is very important. Do not leave this column blank. This information is useful for coding certain diseases and provides a check on the accuracy of the reported sequence of conditions. Therefore, it is extremely important to fill in these lines. Here is another case study. A man dies of cerebral hemorrhage due to secondary hypertension due to chronic pyelonephritis. The patient had benign hypertrophy of prostate gland. He has been a known diabetic too. And the next line, you can see the sequence of events that led to this death. And before that, I will explain some Medical terminology. Here is the human brain. Inside brain, there are blood vessels. So these are cerebral arteries which can bleed and they can lead to cerebral hemorrhage. Some blood vessels can rupture and it can cause hemorrhage. And here you can see a post-mortem specimen of a human brain. There is a blood clot inside. And this diagram explains different locations of cerebral hemorrhage, epidural hematoma, intracerebral hematoma, subdural hematoma. And in this case, we talked about hypertension. Hypertension is persistently high arterial blood pressure. You can measure your blood pressure using a digital device or by using a mercury analog sphygmomanometer. So this means the force of your blood pushing against your artery walls is consistently too high, forcing your heart to work harder to pump. For adults, it is clinically diagnosed when office readings consistently average 140 by 90 millimeters of mercury or higher. What is secondary hypertension? Secondary hypertension is caused by another disease process such as renal failure, diabetes mellitus, Cushing syndrome, primary aldosteronism, and there are several causes of secondary hypertension. The majority are having primary hypertension or essential hypertension, which does not have any cause, but secondary hypertension is always caused by another disease process. And we discussed about kidneys, at least a condition arising in the kidney, chronic pyelonephritis. And these are normal kidneys. And here you can see pyelonephritic kidneys, kidneys damaged by pyelonephritis. And in the case history, we talked about prostate gland. And you can see the prostate gland in this picture is a gland in the male genitourinary system. And when the prostate gland is enlarged, it can cause obstruction to the urinary flow, urine flow. When the prostate is normal in size, there's no obstruction, but when the prostate is enlarged, it can lead to obstruction. So when there is benign prostatic hyperplasia, this means when there is enlarged prostate, there is stagnant urine inside the bladder and the urine flow is obstructed. So this can lead to chronic pyelonephritis when there is chronic obstruction, right? Chronic obstruction. But chronic obstruction in this case is due to prostatic enlargement and there is urinary stasis because urine cannot drain effectively. Therefore, there is stagnation of urine, residual urine inside the urinary bladder, which can lead to chronic pyelonephritis. So in this case, the sequence of events leading to death, the immediate cause of death is cerebral hemorrhage. And cerebral hemorrhage was caused by secondary hypertension. And secondary hypertension is due to chronic pyelonephritis. And chronic pyelonephritis is caused by benign hypertrophy of prostate. So on line 1A, the immediate cause is cerebral hemorrhage. Intervening causes are line 1B, secondary hypertension, on line 1C, chronic pyelonephritis, and the underlying cause of death is recorded on line 1D, which is the originating cause of the sequence. Patient also had diabetes mellitus type 2, so it can be reported in part 2 as a contributory condition. The chronic pyelonephritis was due to outflow obstruction, which was due to benign prostatic hyperplasia. He also had a history of diabetes mellitus, which had been diagnosed 5 years before his death. So, diabetes mellitus, which is not in the sequence of events leading to death, would have contributed to death and therefore should be entered in part 2 of the death certificate. So this is how the death certificate is completed for the previous case study 2. 1A cerebral hemorrhage, 1B secondary hypertension, 1C chronic pyelonephritis, 1D benign hypertrophy of prostate, and in part 2, diabetes mellitus type 2 as a contributory cause. And you can see the time intervals are also recorded. Let's discuss another case study. A 56-year-old man dies from acute myocardial infarction within 3 hours of its onset. His ECG and enzyme levels confirmed the diagnosis. He did not have any other illness. So we discussed about myocardial infarction, which is a condition arising in the heart. And in the heart, there are coronary arteries supplying blood to the heart muscle. And there are healthy arteries, which has normal blood flow. But when there is coronary artery disease, the artery lumen is narrowed and there is obstructed blood flow, which can lead to myocardial infarction when there is inadequate blood flow to the heart muscle. That can be blocked in arteries, and that can lead to heart attacks due to the muscle damage caused by inadequate blood supply. And when there is myocardial infarction, this can be diagnosed by reading an ECG. A trained physician or cardiologist can make a diagnosis. So myocardial infarction can also be diagnosed by using or assessing cardiac enzymes. These enzyme levels directs us to diagnosis of myocardial infarction due to myocardial damage. So in this case, patient did not have any other illness. There is just only one condition reported in part 1, acute myocardial infarction, and the time interval from onset to death is 3 hours. Let's discuss another case study. A 56-year-old person dies from abscess of the lung, which resulted from lobe pneumonia of the left lung. Explaining medical terminology, you can see some images of lung. And this is what happens when there is pneumonia. There's phlegm-filled alveoli, the balloon-like structures inside the lung. Here you can see the normal bronchioles and then a blocked bronchioles. And you can see the fluid in bronchioles and fluid in alveoli when there is pneumonia. So if you complete the certificate, medical certificate of course of death for this case, 1A abscess of lung, which he had for 5 days, and the abscess of lung was due to lobar pneumonia in the left lung, which the patient had for 2 weeks. Another case study, a male aged 54 years was admitted to the hospital for surgery to remove the colon due to carcinoma of the sigmoid colon, diagnosed 6 months before. Patient developed a post-operative deep vein thrombosis 2 days back. Pulmonary embolism later developed and the patient died shortly after. So this patient had a carcinoma in the colon, in the sigmoid colon. The patient underwent surgery and developed a post-operative deep vein thrombosis 2 days later. And then patient developed pulmonary embolism and died instantaneously. So here is a carcinoma in the colon. This patient has a carcinoma in the sigmoid colon, and carcinomas itself or prolonged bed ridden patient following surgery can develop deep vein thrombosis inside veins, deeply positioned veins. There can be thrombus formation, and these thrombi can blood clots can travel, and if they enter lungs, it can lead to pulmonary embolism. So pulmonary embolism, if it is severe, it can lead to instantaneous death. So here is how we certify this case in the medical certificate of cause of death. Line 1A, pulmonary embolism. Patient died within minutes of pulmonary embolism. And the patient had deep venous thrombosis for 2 days. And the carcinoma of sigmoid colon, the patient had it for last 6 months. The duration is 6 months. Another case study, a 70-year-old man dies from cerebral hemorrhage 3 days after its onset. This resulted from secondary hypertension, which he had for the last 1 year. The hypertension was secondary to chronic pyelonephritis, which he had for the last 2 years. And he also had a benign hyperplasia of the prostate for the last 5 years. I think this is the same case study we discussed before. 1A, cerebral hemorrhage caused by hypertension, caused by chronic pyelonephritis, caused by benign hypertrophy of prostate. In all these examples, we had only 4 causes or less than 4 causes in part 1. So how do we report more than 4 causes in the part 1 of the death certificate? In rare situations, there could be more than 4 causes in the sequence leading to death. In this case, you can add a line 1E and record the underlying cause of death in that line. So this is one of the options. Alternatively, 2 conditions could be recorded in line 1D using the preposition due to in between. However, do not record underlying cause of death in part 2 of the death certificate, which is not correct. So here is an example of reporting more than 4 causes. As you all can see on line 1D, the certifier has reported chronic pyelonephritis due to benign hypertrophy of prostate. So he has indicated a causal relationship between the 2 conditions, and the coders will act accordingly because there is an implication of causal sequence. There is another case study. A 60-year-old hypertensive patient was admitted to the surgical casualty ward with severe abdominal pain and vomiting. She was diagnosed as having strangulated femoral hernia with a bowel perforation. She underwent surgery to release the hernia and resect the intestine with an end-to-end anastomosis. 2 days after the surgery, she developed signs of peritonitis, and the patient died 2 days later. Femoral hernia. So this is where femoral hernia occurs, in the femoral region. And this is what happens in hernia. The abdominal content is pushed out through an orifice. Sometimes this orifice can be tight, and this can lead to obstruction and gangrene. And if they burst, that can lead to peritonitis. That means inflammation of the peritoneum. The causal sequence on the certificate 91A, peritonitis, which the patient had for 2 days. And peritonitis was due to bowel perforation, which occurred 1 week ago. And bowel perforation was due to strangulated femoral hernia, which he had for 1 week. Patient also had hypertension that can be considered as a contributory cause, which may have contributed to death, and it is reported in part 2. When we report causes of death in the death certificates, we should know about ill-defined conditions. There are modes of dying such as cardiac arrest and respiratory failure. There are some impossible underlying causes such as symptoms and signs. There are unspecified causes within a larger category, for example, congenital heart disease. You report congenital heart disease instead of allostetrology without specifying the specific congenital heart disease, or intermediate causes such as pathological fracture or portal hypertension can be less specific. However, for the purposes of ICD, there are ill-defined conditions that you should avoid, and these are the codes and the titles. Ill-defined conditions for ICD. So when you apply coding rules, especially SP7, and you will have to know about these conditions. And from chapter 21, except for the conditions below, all the other conditions are considered ill-defined. In addition, there are some general instructions. It is important that doctors pay attention to general guidelines because they will help coders correctly identify and code the death. In most countries, coders are not medically trained. Even a small misinterpretation may result in confusion and incorrect underlying cause of death selection. So we advise doctors to document only one condition per line, use consecutive lines, report time interval, avoid using abbreviations, check the document on clear sequence of events leading to death, and do not enter ill-defined conditions as underlying cause of death. All entries must be legible. Use black or blue ink. Check the accuracy of identification data, including correct spelling of the names. Do not make any alterations or erasures. If you want to delete an entry, draw a single line across it, and do not use correction fluid. A correctly completed death certificate has these features: single condition per line, correct sequence of causes, legible, no abbreviations used, time intervals are recorded, and the reported underlying cause of death is not ill-defined. External causes or the circumstances of the accident or violence is reported. And if you report neoplasms, details of neoplasms are reported: site, behavior, morphology, etc. So this brings us to the end of this video. And if you have further questions, please contact us. Thank you very much.